Hello, it's Tim King, the Respiratory Rashi. This means teacher, and I try to make things that are complicated more easy to understand. I want to talk about trachs. Someone sent me a message and asked me to speak about trachs and trach care. The first thing I'll say about trach care is that it is important to keep it clean. If you've learned anything, if you work in healthcare, you may have learned how to take care of an ileostomy, a colostomy, a nephrostomy. A tracheostomy is no different. You have to keep them clean. You have to keep them dry. And that's the best way to take care of them and keep them comfortable and the patient's comfortable with you messing with them. The worst thing you can do is let them get soiled and let them stay wet. That's breeding grounds for an infection, and an infection is when colonized bacteria cause damage to the skin and tissues, and then the patient's not going to want you to touch that site at all. They'll be very fearful, very scared. So the most important thing is don't be scared of it. Just make sure you take care of it. If the patient has a trach that requires a tracheostomy tube inserted into it, it's important to keep that airway cleaned out, because that is what they breathe through. That is what gives you access to suction the airway out. It's also important to keep it tied. That you have to be real careful when you're changing dressings not to undo the straps until you're ready to undo the straps. And when you do undo the straps, have your other strap ready. Hold one finger on the tracheostomy tube while you undo it, and then slide one side and lock it around. And I usually attach the Velcro to the strap, from the dirty strap to the clean strap. And then when I pull the dirty strap from around behind the back of the neck, it pulls the clean strap around, and then it's in place, and I can untie it and slide it through and lock it in place. The important thing is just keep it clean. Think of it like a baby's bottom. If you let a baby's bottom get dirty and stay wet, it becomes real tender and sore, and now you're having to do a lot of work to get the problem that you created, the rash and things, to calm down. Same thing is true with a stoma. Any skin is going to act the same way, whether it's your baby's bottom or whether it's around any stoma located anywhere on the body. Something else I want to talk about is trachs, is that when a patient swallows, a tracheostomy tube is in the airway through the stoma. It's going to anchor the trach. If you could sit here and hold your hands right here and swallow, you'll feel the Adam's apple and the cricoid cartilage move up. You could feel all these muscles doing things. With that tube in place, it makes the patient much more likely to aspirate, because the tube is preventing the trachea and the mechanism of swallowing from being able to occur. No different than if a child was wrapped around your leg as you're trying to walk, let alone if you try to move quickly, you'd be more likely to trip and fall. And that's a similar thing that's going on when the patient has a trach. So that, small amounts, be careful, think through as they try to swallow, be mindful to make sure that the food goes on. But don't be afraid to swallow. I had a patient one time, and this was a rare situation, but I was watching the patient. He ate. He didn't aspirate at all. He'd been admitted to the hospital 3 months consecutive with pneumonia when I read through his chart. I watched him eat his food, and I was in there just taking care of him, and I noticed that he wasn't having any troubles at all, but I had figured out that he must be aspirating and getting his pneumonias again and again. And I saw a cup sitting beside his bed. It was a spit cup. He just constantly spit his saliva in the cup. And I said, "Sir, are you spitting saliva in the cup?" He shook his head, "Yes." I said, "Are you afraid to swallow?" He said, "Yes," because I saw him just letting saliva pull in his mouth after he finished eating. I said, "You just ate all that food. You didn't have any troubles, right?" I said, "Swallow your saliva." In fact, I said, "Do it for me right now." He swallowed his saliva. I knew immediately we had solved his problem. I called the pulmonologist. I reached out to him and explained to him what I'd discovered. And I said, we can decannulate him. He doesn't need to go to the nursing home. He was getting ready to be discharged to a nursing home. He's going to live the rest of his life in a nursing home. Instead, he was able to come home, have the tracheostomy tube decannulated, and the stoma closed up, and he was able to live the rest of his life without a trach. It's the little things that you do like that that make the biggest difference. For years, I would see this person in a mall or in town somewhere, and he'd yell at me and scream at me, hey, hey, hey. He'd come and give me a hug, and he said, you saved my life. I didn't save his life. I didn't do anything. It was just simple. I recognized that he was scared to swallow, and he was letting his oral secretions pull in his mouth. You'll see that it's usually the simple things that make the biggest difference in outcomes in patients and the care for those patients. But just remember that the tracheostomy tube does put the patient at high risk of aspiration. The other thing is that if I asked you what prevents a patient from aspirating, you would probably tell me the epiglottis, but that is not true. It's the vocal cords. The vocal cords' job are to, when something tries to go past the vocal cords, they're supposed to clench up and tighten up. The example of explaining how that happens is that the dry drowning. You've probably heard of people drowning, but a dry drowning, what it means is that basically something tried to go past the vocal cords. It could have been dry. It caused the vocal cords to spasm up and clench up. It could be a small amount of water. It could be some acid reflux. It could be an object floating in through the air in the fall that you inhale. It touches the vocal cords, makes them spasm up, and prevents the patient from breathing until they calm down and let the cords open back up. And so that's the vocal cords would actually protect your airways from aspirating. And what they do is they create subglottic pressure. So the epiglottis is a flimsy piece of material that flops around, and easy for stuff to leak past it when there's no subglottic pressure. If you've ever seen a bouncy bounce, what it does is it needs air and pressure to make it puff up and strong enough that things can bounce on it. And so that's how the epiglottis is able to protect your airway. It's not because the epiglottis is doing the work. It's because the vocal cords are letting out enough air to support the epiglottis, create a pressurized support system, like an air splint, holding the epiglottis and supporting it and giving it strength to let things bounce off of it and roll away. So without the vocal cords, you could not, if we remove your vocal cords, you could not protect your airway. So again, it is not the epiglottis that actually protects your airway. It is the vocal cords that do that job. And so there's a device called the Passamere valve. I'll talk about that one day in the future. But the Passamere valve, if you put that on someone's tracheostomy tube, it allows them to speak. The other great thing it does is it allows them to create subglottic pressure, creating the support system, like the bouncy bounce for the epiglottis, helping to prevent the patient from aspirating. Also, we all microaspirate. Everybody microaspirates. Having that subglottic pressure allows us to clear our throat when maybe acid leaks in there, or secretions leak in there, or maybe whatever we just ate leaked into our airway just a little bit, and we just clear our throat and cough it out. That's what the Passamere valve allows the patient to do. So a lot of times people are not allowed to use a Passamere valve when they eat, but actually having the Passamere valve could potentially help them not aspirate. Okay, so tomorrow I've got another topic to talk about, and it'll be sputums. I want to talk about sputums for CNS.